Hello! I'm Kimberly MD, neurologist and sleep expert, here to help you, my sleep warrior, achieve amazing sleep with science-backed education and expert advice. So today's question is, I can't keep my mask on. I take it off when I'm sleeping. Please help. Well, this is a really common question. A lot of times people end up taking their masks off and they don't even realize it during the night. So my recommendations for solutions to this problem include number one, try to find a better fitting mask. There's something subconscious going on during the night that is making you uncomfortable and making you want to get that mask off your face. Masks are like shoes. You need to try a number of different ones before you find the one that is going to fit you just right. So try different ones, try multiple different ones to find something that is really comfortable. My second recommendation is wear your mask more while you're awake. Just when you're hanging out, watching TV, let your body get used to having something on your face. Then it will be less weird when you're sleeping and you'll be less likely to want to take it off. If those things don't work, then you may try adjusting the straps, using some type of strap cover to make it more comfortable, or sometimes a more secure fitting mask with more straps and tighter around your head may help to prevent you from actually getting it off during the night. Just the main thing is don't give up, keep trying, and thanks for asking your question. How can I control the air leaking around my mask that is waking me up? Well, you are not alone. This is a very common complaint of CPAP users, especially new users. So the most important thing is don't give up. If you're experiencing air leaking from around your mask, then I recommend you try one, a different size of mask cushion. Two, you may try a mask liner. These are things like REM-Z's, or there are some at patacheek.com that can be used around your mask to just eliminate some of those little pesky leaks that are blowing through and maybe noisy and irritating. The other thing is to try a different style of mask. So it may be that your face is shaped in a certain way that isn't fitting well with the type of mask cushion that you're using. There are lots of different masks out there. Masks are like shoes. I always say what works for one person doesn't always work for another. So you need to try different ones, find ones that are comfortable for you, for the shape of your face and your nose. And if you haven't found that perfect one yet, keep trying. My last suggestion is that some of the masks do have memory foam cushions, and those tend to form better to your face to eliminate some of those leaks. So just Google CPAP mask memory foam for that. Thanks for your question. Do chin straps work? Well, yes and no. So I don't really like chin straps, but they do help to solve a very common problem with sleep apnea, which is oral leaks. So I'm a big proponent of nose breathing and the nose masks that cover just your nose, not your nose and your mouth. They're much lower profile, they're more comfortable, they're easier to tolerate. But what happens if your mouth drops open, or you're one of the 50% of people out there that experiences mouth breathing during the night? Your mouth drops open, your machine coming through your nose starts blowing through your mouth, and there's a bunch of dry mouth, noise, discomfort, and you're not getting the therapy that you need where you need it, which is in the back of your throat. So a chin strap is one solution to this problem. It goes around your head and it holds your chin up. Now, the two reasons I don't like chin straps are, one is it's another strap and it tends to cause some claustrophobia. So it holds your jaw in a really locked position, and this can cause people to feel a little bit tense inside, and that's not ideal for sleeping. The other thing is that sometimes the chin straps actually push your jaw back a little bit as they're trying to keep your jaw up because it's attached to the top of your head. It can pull your lower jaw back, and that backward displacement of your jaw can actually worsen your sleep apnea because it works to help close off your airway or make your airway more narrow. It can also result in some TMJ problems. So not a huge fan of the chin strap. This is exactly why I created something called the Somnoseal. So you can check it out at somnoseal.com, but it's a device that sits inside your mouth that allows your jaw to stay a little bit relaxed while blocking the air from coming out. So you might give that a try. If neither of those work for your oral leaks, then the next option would be a full face mask that does cover your nose and mouth. But these masks do tend to leak more, and the pressures of CPAP tend to need to be higher when you have a full face mask. So good luck. Thanks for your question. I feel like I'm suffocating when I wear my mask. Please help. Well, this is a pretty common question because when you've got air blowing in your face, sometimes that can make it feel like it's hard to breathe, which can feel like you're suffocating. So that's no good. There are ways around this. The main reasons why you may feel like you're suffocating maybe because the pressure is one, too strong, and so you feel like you can't breathe out against it. The CPAP is a continuous positive airway pressure. So it's one pressure that's constantly going in. And so that's very good when you're inhaling, but when you exhale against this pressure, sometimes that can be associated with the feeling of suffocation because of a really high pressure. The other reason why this could happen is that the pressure is too low. So if you have very significant sleep apnea and your machine is starting out at a really low pressure, especially if you have the ramp turned on, then you may feel like you're not getting enough air. So if this is happening, I recommend you talk to your provider who can look at the download of your machine and see if it looks like you're needing a higher pressure, or maybe they might be able to lower the pressure a little bit just so you can get used to it. And then once you're used to it, they can increase the pressure again. If neither of these things work, you may consider talking to your provider about a bi-level device. This is two different pressures, one going in and then it drops out as you exhale, which can make it feel a little bit easier to breathe against that forceful pressure. So thanks so much for your question. I need a sleep study. I know I have apnea. I wake up feeling like I'm being strangled. Well, that sounds like an awful feeling, and chances are you probably do have sleep apnea. One of the primary symptoms of sleep apnea is waking up with a choking sensation. This is because of a pause in your breathing from a blockage in the back of your throat. So if you think that you may have sleep apnea, the next step is to get a sleep study or a sleep test. This can be done in the lab, like in a sleep lab, or it can be done at home. There are a lot of different types of home tests now, and these are usually first-line diagnostic tests for most adults who feel like they have sleep apnea. So what you should do is talk to your primary care provider who can either order a home apnea test directly or refer you to a sleep lab who can then order that home apnea test for you. There are also some online options available, so you may look for what's available in your area. You could try Googling home apnea test. But one key is that even though home apnea tests are more ubiquitous and less expensive, they are less accurate as well. So if you feel like you are having these symptoms of sleep apnea, you're feeling tired, you don't feel refreshed when you wake up in the morning, poor concentration, or more irritable during the day, any of those symptoms, if you have a negative home sleep test, I strongly encourage you to talk to your provider about then having an in-lab sleep study, because the home tests can miss sleep apnea up to 30% of the time. Thanks for your question. I just don't know the best practices of my CPAP. Can you help? Well, I don't know exactly what you mean by best practices, but I will say that I have created a CPAP 101 class that is on my website at kimberlymd.com that goes over everything from how to prepare for CPAP, how to get started on CPAP, how to maintain your CPAP, when and how to clean your equipment, what replacement schedules should look like, plus a whole host of troubleshooting tips. So there's a lot of best practices, and I recommend checking out my course, CPAP 101. There's just too many to try to tackle all of them in this short video, but I hope that you will check out my website and get your answers there. Thanks for your question. Thanks for all the questions today. You can ask at our link below, where you can put in your questions that I will answer every week here on Ask the Expert. Thanks for joining me.